This video shows a rusted, heavy hinge fighting to open, a mechanical struggle that probably feels incredibly familiar if you're over 60. That morning creak, the cautious inventory of aches before you even step out of bed, is a daily reality for millions. For decades, we've treated this stiffness as pure mechanical wear and tear. The assumption is that you've simply used your knees and hips for so long that the tread is wearing off the tires. But the biology points to a different culprit entirely. As we age, our bodies undergo a shift into a state known as inflammaging. Your immune system stays perpetually overactive, treating healthy joint tissue as if it is under attack. Standard over-the-counter painkillers address the symptom. They quiet the nerve signals so you don't feel the ache, but they do absolutely nothing to turn off that chronic, low-grade immune response driving the damage. To actually reprogram that inflammation at the cellular level, we have to look at the micronutrients we consume. 5 specific seeds, flax, chia, hemp, sesame, and pumpkin, are biological powerhouses, packed with compounds that can intervene in this exact immune response. True long-lasting relief requires us to alter our body's internal chemistry, turning off the alarm system, rather than just trying to grease a noisy wheel. If we look closely inside a single aging knee joint, the immediate source of the pain is a chemical imbalance. There is a surplus of pro-inflammatory signaling molecules causing localized swelling, which creates the physical friction you feel. This diagram shows alpha-linolenic acid, or ALA, from flax and chia seeds. Watch the geometric ALA molecules block the red inflammatory waves producing prostaglandin E2. By shutting down these signals, a smooth blue fluid forms, acting as a biological lubricant. While the ALA is lubricating the joint, compounds called lignans, highly concentrated in sesame and flax seeds, are acting as a defensive shield. They neutralize free radicals, which are destructive molecules that attack the collagen matrix, protecting the chondrocyte cells responsible for building healthy cartilage. But armoring and lubricating the inside of the knee only solves half the problem. It does nothing to relieve the mechanical tension pulling on the joint from the outside. Surrounding that perfectly lubricated cartilage is a complex network of muscles and tendons that dictate exactly how the joint moves and bears weight. When those surrounding muscles are chronically tight or spasming, they pull the joint slightly out of its natural alignment. Over time, that misalignment forces the cartilage to wear down unevenly, accelerating the degradation no matter how healthy the interior fluid is. This tension is often the result of a simple magnesium deficiency, a very common issue in adults over 60. Fortunately, pumpkin seeds serve as a highly concentrated delivery system, providing nearly 40% of your daily requirement in a single ounce. This animation shows a tightly knotted muscle fiber bathed in calcium, which causes contractions. When we introduce magnesium particles, they bind directly to the receptors, acting as a natural calcium blocker and forcing the muscle fibers to chemically relax and lengthen. With those muscles relaxed, they stop pulling your joints out of position. The newly lubricated cartilage can finally operate with its proper structural alignment, preventing the friction that causes daily pain. We've repaired the joint and relaxed the muscles, but if we zoom out to the entire bloodstream, we have to ask why the immune system started attacking the cartilage in the first place. Physicians measure systemic inflammation by checking C-reactive protein, or CRP, in the blood. Clinical data shows that consuming hemp and flax seeds steadily lowers elevated CRP levels, cooling off the body-wide immune response. Curious, and medical researchers are finding that the origin of this systemic fire is located far away from the knees or hips. It starts in the digestive tract, through a pathway known as the gut-joint axis. This shows a leaky intestinal barrier, where pro-inflammatory bacteria slip through gaps into the bloodstream, triggering joint flare-ups. Chia seed prebiotic fiber ferments into short-chain fatty acids, creating a thick gel layer that physically seals these gaps, blocking the bacteria. By reinforcing the intestinal barrier, we cut off the flow of inflammatory triggers. The immune alarm system powers down at its source, protecting every single joint in your body simultaneously. Moving this science from the laboratory into your daily life is straightforward, and it starts with your morning breakfast. To successfully lubricate the cartilage, relax the surrounding muscles, and seal the gut barrier, you only need to consume a combined total of 2 to 3 tablespoons of these seeds every day. There are a couple of rules for preparation. First, flax seeds must always be ground before you eat them. Their outer shell is too tough for the human digestive tract, and grinding them ensures your body can actually absorb the crucial ALA and lignans inside. Look closely at this video showing chia seeds in water. To activate their gut healing properties, they should be soaked. As they absorb the liquid, they expand into that thick, clear gel matrix that supports your intestinal lining. As for hemp, pumpkin, and sesame seeds, they are ready to go as they are. They work perfectly as a topical sprinkle over a bowl of oatmeal, mixed into Greek yogurt, or tossed onto a salad. Reprogramming your body's immune response takes a bit of time. Clinical studies show that measurable drops in systemic inflammation and the physical relief that follows reliably occur after 8 to 12 weeks of consistent daily consumption. By deliberately feeding the gut-joint axis every single morning, you stop fighting a losing battle against mechanical wear and tear. You take control of your internal chemistry, turn off the inflammatory fire, and actively reclaim your mobility.